Does sudden cardiac affect the elderly the most? The answer is no. It's a common myth that heart disease happens in the older people and they will die more from sudden cardiac arrest. Sudden cardiac arrest can happen to anybody. It can happen to a baby as old as 1 day to any older people. Usually in the younger patients, they have a predisposition for this disease because of some genetic heart conditions such as long QT syndrome, hypertrophic cardiomyopathy, abnormal genes. In the elderly, it's most often brought in by prior history of heart disease such as having a heart attack or some other inflammatory disorders of the heart. One of them being hypertrophic cardiomyopathy, as I mentioned before, other inflammation of the heart such as sarcoidosis, which is also a very common disease, especially affecting more African American and our Black population. How can sudden cardiac arrest be prevented? By raising awareness of this entity, that this is one of the leading causes of death in this country. And we can raise the awareness by increasing the awareness of preventing the heart disease to begin with, which is the common sense things, don't smoke, watch your diabetes, watch your blood sugars, control your blood pressure, more exercise. Also, it can be prevented at least by screening, especially in patients who have family history of sudden cardiac death. If you have a family member who has died suddenly with no explanation, you may want to get checked with your primary care or your cardiologist, who may do some testing such as an EKG, an electrocardiogram, or an echocardiogram. How common is sudden cardiac arrest? It's the third lead cause of death in the United States. Almost 350,000 people worldwide die from this condition. 1,000 patients die every day in this country. So it's one of the most common causes of death after cancer or traumatic or a car or motor vehicle accident. Is sudden cardiac arrest the same as heart attack? It's a common myth that people interpolate or say these things in conjunction, but sudden cardiac death is an electrical problem of the heart. A heart attack means there is a temporary or a permanent stoppage of the blood supply to the arteries of the heart. So the heart still keeps beating, but there's no blood flow to a segment of the heart. And that's what is called a heart attack, which shows up as chest pain, shortness of breath, sweating, and things like that. Sudden cardiac death means the heart has stopped beating. A heart attack can cause sudden cardiac death, but these two are two separate terms and entities. Is there anything a bystander can do to prevent sudden cardiac death? Absolutely. When sudden cardiac death happens, which happens mostly at home, almost 70 to 80% of sudden cardiac death occurs in home. 10 to 20% occurs in public. When it happens at home, obviously if there's no bystander, the chances of surviving a sudden cardiac death is practically zero. Even in today, the survival rate from a sudden cardiac death is only 10%, which means if you die suddenly or have a cardiac arrest, you only have 1 out of 10 chances to be survived. If somebody standing next to you who has witnessed you, what we call a witnessed cardiac arrest, which can happen in public, at home, or in a hospital, and if a bystander comes and responds, they can alert the 911 services. If you have an automatic external defibrillator, they can turn it on and save your life. So yes, having a bystander can increase the survival by 50%. What are the risk factors for sudden cardiac arrest? There are many, as we all know: hypertension, diabetes, smoking, obesity, lack of exercise. All these things are predispositions for heart disease, such as heart attack. And as such, heart attack can further lead on to sudden cardiac death. But there are some risk factors which we can control, there are some we cannot control. The uncontrollable ones are where you're born with an abnormal gene which can cause the heart muscle to thicken, such as hypertrophic cardiomyopathy, or another gene called a long QT syndrome, where the heart takes a long time to come back to its normal electrical state. So those are the usual common reasons. There are some drugs which can predispose patients to sudden cardiac arrest. Drug abuse such as methamphetamine, cocaine can cause a heart attack, which can lead on to sudden cardiac death, to name a few. What are the signs and symptoms of sudden cardiac arrest? Unfortunately, as the name implies, is sudden cardiac arrest. So usually there are no signs where the patient can think it's coming. The usual sign is when the heart stops beating, the patient will collapse. Depending on what they're doing, they can fall or they can be in the bed, and basically they are dying. There is no heart pumping, there is no circulation of blood throughout the body, and the patients usually have become limp, become pale, can become blue, and basically die. So usually no symptoms. Rarely a patient may feel a heart fluttering or a palpitation before this event coming. Because this event is so catastrophic and life-threatening, patients usually don't have any time to feel the symptoms, because when the heart goes into ventricular fibrillation or sudden cardiac arrest, it stops immediately, and it's a matter of seconds before you collapse. What causes sudden cardiac arrest? Before I answer that question, we need to define what is sudden cardiac arrest. Sudden cardiac arrest or sudden cardiac death, as the name implies, means sudden cardiac arrest, which means the heart stops suddenly. It means the heart muscle, which is a pump, stops functioning. What causes this is usually an electrical problem, a rhythm called ventricular fibrillation, which is a very fast, irregular, chaotic rhythm from the bottom chambers of the heart. When a patient or a person goes into ventricular fibrillation, the heart cannot pump the blood effectively. It essentially stops functioning, and the patient can die if not revived at time. Ventricular fibrillation can be caused by many things, common being history of heart disease such as heart attacks, or congenital heart problems such as rhythm problems where people are born with abnormal genetic problems, or abnormal muscle thickening called hypertrophic cardiomyopathy. Sudden cardiac arrest happens quite a bit, is one of the leading cause of sudden death in this country. Actually, it is a national crisis. By the time I finish this interview, almost 4 people would have been dead by the time I finish this interview. Almost 1,000 people in this country die every day from sudden cardiac arrest. What causes sudden cardiac arrest in the young people? In most young patients, the sudden cardiac arrest is usually brought on by some abnormal genetic conditions, such as hypertrophic cardiomyopathy, which I mentioned before, is a thickening of the heart muscle due to a gene disorder, or long QT syndrome, which is due to abnormal heart's repolarization. In layman, that means the heart goes, every heart beats, the heart goes in an electrical state, and then it has to return back to its normal state. In the patients who have long QT syndrome, the heart takes a longer time to come back to its normal electrical state, which can bring on this rhythm problem called ventricular fibrillation, which is sudden cardiac death. Usually that's a genetic condition where you're born with an abnormal gene. Sometimes some drugs can cause that. But in younger patients, these are the 2 most common reasons for sudden cardiac arrest. Another common one is what we call commotio cordis, which is sudden jolt to the chest of a player, for example, with a baseball. Sudden threat to the chest can cause the heart to get stunned, which can induce sudden cardiac death. Who survives sudden cardiac arrest? As the name implies, it's sudden cardiac arrest or death. So if somebody is next to you or somebody has witnessed you and brings on the appropriate 911 services or an automatic external defibrillator, those are the patients who can be revived and bring back to life.